Welcome back to Medical Monday. I'm here with Dr. Jason Haslam. We're talking about all things covered by an orthopedic surgeon because that's what Dr. Haslam is, but especially the hand, wrist, and elbow and shoulder today. So if you have any questions, any pains and aches concerning that, go ahead and give us a call. The number is on the screen. 615-737-PLUS is the number to call. We're going to jump right to the lines. Helen has been patiently waiting. Helen, go ahead with your question.
Yes. Hi, my name is Helen Ambrose, and my left arm, I recently, well, not recently, but 15 years ago, I had a four-wheel accident, and I broke the right arm, or left arm, I'm sorry, above the elbow, and blew the elbow, and I had surgery with pins put in it to correct that problem, but I'm still not able to, like, bring a cup of coffee to my mouth or touch my face with that arm, and I was going to have surgery, elbow replacement on that arm, but it sort of scared me. I don't really know what I should do. And my question is, do you think that would be the best thing to do, or would there be another way to correct that problem?
Well, Helen, I think you're describing a problem with your lack of motion. When you can't bring your hand up to your face, that usually means the elbow's not able to function well enough to get up there. So, and that's very common after you have an injury, for example, a fracture around the area of the elbow. So, yeah, the decision to do something like a total elbow replacement, that's a big, big decision, so I can understand your apprehension. It's a big surgery too. But the best thing to do is perhaps, well, you know, in my mind I'm thinking, I wonder what that elbow actually looks like. So a good set of x-rays will give us a lot of good information about your elbow, and may give us some information on, or at least help us, guide us on how we could best treat you. The short answer to your question is, should you do a joint replacement or not? It really depends on what your x-rays show. And though it's a good operation, it is a big one. And so other types of options that might be available to you would be what we call a capsular release, and that's where we release the joint capsule or the ligaments to allow more motion of the elbow. And we oftentimes will do that using what's called an arthroscope. So we use a small camera to get into the elbow and look around. If there's other things, for example, if there's a bone spur which is blocking the motion of your elbow, sometimes we can actually remove that with using just the camera, and sometimes you can preserve the joint. My preference is to try to preserve the joint, but when it's not something that's salvageable, then we end up going with the total elbow.
If she had an x-ray and what would be the things you go, oh, this is not good? What would it show?
Well, the classic x-rays with bad findings would be elbow joints that no longer have cartilage in it. Or there's very large bone spurs around which are blocking the motion. Those are the ones that I get concerned about, because no matter what you do, if you don't have cartilage, it's just not going to work well. So that's when you resort to the total elbow arthroplasty, or the elbow replacement that you're talking about. What
kind of recovery time are you looking at with an elbow replacement?
So once you put them in, it takes around 6 weeks to kind of recover from the healing process. And during that 6 weeks we start physical therapy. You're in a sling for a short period of time, but the design of these elbows is to get them moving quickly, because you know, one of the biggest problems is range of motion, so we're pretty aggressive about trying to get that motion back. So there are elbow replacements, just like there's replacements in the knee and hip, and elbow replacements have been out for a long time, but their ability to stand a long period of time, that's not that great. So they only last around 7 to 8 years on average, in general, depending on how you use them.
Wow,
so,
that's interesting.
Yeah, and then if they fail, or if they're not working very well, then you end up having to go back in and do a revision surgery, and the complication rates go up double.
Okay,
so it's a serious operation.
Good information. Hopefully that helps you out, Helen. Gwen on the line. Gwen, thank you for calling in tonight. What's your question?
Well, I have inherited some bone conditions like osteoporosis, but I was wondering if you can inherit carpal tunnel syndrome.
That is an excellent question. We actually don't know exactly why carpal tunnel syndrome happens, but the reality is it is DNA based, and many orthopedic surgeons and hand surgeons believe that carpal tunnel syndrome probably is related to genetics. And so the short answer is yes, you are probably right. You can inherit maybe the factors that affect carpal tunnel syndrome. It's probably a multifactorial problem. There's probably several things that cause it. We do know that endocrine changes, for example, if you have diabetes, that puts you at a higher risk for developing carpal tunnel syndrome. even endocrine changes, even with pregnancy. It's a higher risk for women that are pregnant to have carpal tunnel syndrome. So there are some factors, but you're absolutely right. There are genetic factors involved too.
And I guess if you have it, it just stinks either way, whether you inherited it or it's because of overuse.
Yes,
it just
hurts.
stinks. Yes,
Yeah.
it hurts. There's no
hurts.
change in it. Okay, Sandy is on the line. Sandy, go ahead with your question tonight.
Hi. I'm 67 years old. I have these cramps that come in my fingers, and it's like if you have a cramp and you have to stand on it with your foot to get it out of your leg. They're very painful, but if I take my other hand and work and move it around, it will release and go away, but it's no pattern that I can figure. I'll just start to pick something up and I'll have like just a major seize cramp.
So kind of like a Charlie horse in your finger?
Kind of like a Charlie horse in my fingers.
Okay, well, let's see what Dr. Haslam has to say about that.
Just a quick question for Sandy.
Okay, hang on, let me see if I can get Sandy back on. Okay, go ahead.
Quick question for you, Sandy. Do you have symptoms at nighttime? Does it ever wake you up?
Oh, let's see.
Yes, it has awoken me, yes.
So what you're describing is kind of this cramping in the hand. It's very common to see with this diagnosis of carpal tunnel syndrome. When you're using your hand, a lot of times you'll develop this cramping, and it can be just on one side. And that's a very common finding with carpal tunnel syndrome. Many patients that have carpal tunnel syndrome also have a lot of symptoms at nighttime, so that's oftentimes the first question I'll ask is, what's happening at night? Does it ever wake you up? Many patients will find they have to shake their hands.
Is it just from use during the day?
We don't know exactly why. We do know that it's a compression on that nerve, and for some reason, many patients at night, I don't know exactly why that happens, but that nerve will really start to become irritable. But it's frequent to have patients have cramping in their hand. Nowadays, it used to be holding a newspaper. Now it's I'm holding my cell phone
yes, they're doing
or
this.
texting away, and I can't text. So it's very common to see that particular problem.
You start to pick up a cup of coffee or anything, and it'll just like lock.
Yeah, it's very common, and many patients will drop objects. So I suspect, just listening to what you're describing, it's highly likely that you might have carpal tunnel syndrome.
Okay.
Sorry to deliver the bad news.
Thank you so much.
Thank you, Sandy, for calling in. We appreciate it. Man, I tell you, these phone lines are just lit up. We're going to get to Lisa now. Lisa, thank you for calling in. Lisa, are you with us?
Yes, I am.
Good, go ahead.
Okay, I have a question. The doctor said I had carpal tunnel, but every night my hands swell up and I can't move them. And I try to get a brace, but my hand is so small that the brace doesn't fit. What do you suggest?
Okay.
Well, sometimes it's hard to find braces that fit you, and so it's worthwhile to try to get one. In our office, we have all different sizes. If your hand's small enough, we can even have pediatric braces, so we can always find a brace that's going to fit you. That's the mainstay of treatment. We try to get it better with the brace, but if that doesn't work, come into the office. Let's put a little cortisone or medicine around that nerve and see if we can't get it better for you. Carpal tunnel syndrome, it's related to a nerve, and so there are other tests that we can get to diagnose it. There's what are called electrodiagnostic studies, which basically test that nerve almost like you would test a wire to see if it's conducting electricity appropriately. And we'll oftentimes get that test if there's any questions about whether you have carpal tunnel syndrome or not.
Is it definitive?
It's not definitive. It's just a tool.
Good guide.
Yeah, it's a guide that helps us to understand how bad that carpal tunnel syndrome is. But it's not definitive. Unfortunately, there's not a lot of definitive tests in medicine.
True. Okay. Elma's on the line with us. Good evening, Elma. Hi, go ahead. Good. Go ahead with your question.
Okay, I wanted to ask the doctor. I had carpal tunnel surgery about 19 years in both wrists at the same time. How long does that last? I haven't had any problems, is what I'm saying. I just wonder how long that lasts.
So if you look at the literature on carpal tunnel syndrome, there is a recurrence rate after you do surgery. It's about 10% of patients will have a recurrence within about 10 years. So you've had 19 years on your carpal tunnel. That's pretty good. If you came into the office and I was suspicious that you had carpal tunnel syndrome, I might get that nerve test to kind of see how bad your nerve really is. But it's very possible that you could have a recurrence of carpal tunnel syndrome.
Okay. Thank you, Elma, for calling, and hopefully everything holds okay for you. Edna is on the phone with us as well. Miss Edna, go ahead.
Yes.
I brought my husband cigarettes, and I've had a knot that's come up on my arm, around my hand, my left hand, and it swells up. And now it's moved about 2 inches up, and it's swelling up. And I get knots on them, and I was just wondering what that could be.
Is it primarily around the wrist that you have that?
Yes.
Yeah. So those knots that come up, the most common knot that forms around the area of the wrist is what's called a ganglion cyst. We mentioned that just earlier. And again, what that is, and most likely what it is this ganglion cyst. It's fluid which comes outside of the joint and forms a small bubble. Sometimes it's a large bubble in your situation, but they can be quite large. Sometimes they don't hurt patients. Other times they're worried about because it's a cosmesis problem. It's so large. Sometimes it does cause a lot of pain. So ganglion cysts, they can be either drained, removed. You can just watch them. Sometimes they'll go away on their own. But that's probably what it is. To know definitively, we have to see you in the office and sometimes use an ultrasound.
Okay, very good. On that note, we're going to take a quick break. We do have a few phone lines open, so if you want to give us a call, now is your opportunity. 615-737+ is the number to call to talk to Dr. Hasselman. We'll be right back.